Okay, welcome. Today is another day for Truth for America, and I have a special guest with me here in the office. I'm here with Dr. Corrado. Doc, I wanted us, I was reading the paper and I saw you actually pulled the trigger and decided to go ahead and retire. Didn't think it'd ever happen.
I didn't either, to tell you the truth.
Well, I know how long you've been in it, and I know the impact you've had on me and an awful lot of folks in the county. And one of the things I like to do on this show is to highlight, strong things, important things here in the county, and things that have made a difference. And you have the rare opportunity to be in one of those guys that actually have made a mark in this county that's going to live for a long time.
Thank you for the compliment.
Well, it's well deserved.
Well, I feel that I'm blessed because I've had the opportunity to help others.
Funny how it works that way sometimes.
It's very, very funny. Yeah.
Well, we were talking a little bit before we started the interview today, just on some of the stories and things from the past. My experiences in EMS and all, and with the hospital. I can't imagine the things that you have seen, heard, and done over the years. First off, my respect level for docs. Having gone through paramedic training, and I went through some extra training, a lot of special training, and I've seen the stuff that docs have to do to become a doctor, and the sacrifice and the time and the no sleep and the crazy food and all the things you got to do. I think the only one I have maybe a little more respect for is probably the military, but you guys go through so much to become who and what you are. It's amazing.
Yeah, I can echo that, but I'll say one thing more. What paramedics do, what EMTs do, is a lot harder than what we do. I have a nice, sterile place. I have lots of help. I can control my environment. The paramedics, the EMTs, the first responders, they can't control that environment. They don't know what they're going to get into. I have a lot of anxiety because I'm not sure what's going to come in through that door. But you guys are going out. You're in danger. I tell you, my hats are off to all the first responders and all the paramedics. What a fantastic job they do.
Well, thank you as well. I cherish my years of service that we're in. And
I remember them. Yeah.
The guys that are in, the guys and girls that are in now, face even more challenges than I did.
Absolutely.
The training is much different. There's much more to it. We've advanced on so many things.
Sure.
The world has changed so much. As bad as it was when I was doing this stuff. We're talking in a conversation the other day about just the drug epidemic, and for me, if I gave Narcan 6 times a year, it was a big deal. And now these guys are giving it 6 times a shift to the same person.
Absolutely.
It's an amazing change, and you were right there for all of this. And I like the term that Rick Adabata used. You're the father of EMS in this county, and that's absolutely correct. You were the guy that stepped up and took the responsibility of putting all these medics under your wing and your license and everything else. That took a lot of courage, and that's one of the other things I like to do on this show is spotlight folks that have courage enough to do things because you knew it would help the area.
It's been my fortunate chance to help out. I feel that I'm truly blessed that I just was in the right area at the right time. And as I was telling some of my colleagues, I came in to emergency medicine in its infancy. It was a newborn.
For sure.
When I first started in 1960, actually it was 65, even though I came to the hospital in 66. But I did do an emergency shift for a year at Pittsburgh Hospital in Pittsburgh, Pennsylvania. It's no longer there. It's a nursing home, I believe, right now. It's over on Frankstown Avenue. And at that time, they were bringing patients in the paddy wagon, in the police, and they would just bring them in and dump them in. No knowledge that they were coming. No pre-hospital care. It was really ancient medicine, actually.
You were even before. I mean, I can remember as a kid watching Gage and DeSoto on Emergency 51 and just saying, man, I want to do that.
Yeah, right. That wasn't even thought of then.
And really. it was brand new then in only one city in Los Angeles at the time.
Yeah, that's right.
And you were even before that by a good ways.
Yeah. And there was a big white paper. It was probably in '68 about the epidemic. You talk about epidemics now, about the opioid epidemic. This is the epidemic of people dying from auto accidents and the horrible care that they got in emergency departments before, run by sometimes by no physician being there, or if there was a physician, it was a physician in training who had no experience, had no backup. And that was the caliber of the emergency department in my day when I first started. And it was just kind of fell into it, and it's been a wonderful trip since.
Yeah, I mean, can you imagine, folks? We built cars back then like tanks.
They
they weren't built.
And no seat belts.
no seat belt. Much higher speeds, much bigger engines.
Yes.
We didn't do airbags and seat belts. And all those. Speed limits were a lot higher. And you guys are truly the front line for all medicine in the hospital.
Absolutely, yeah.
But back then it was kind of all the way down on the other side.
Yeah. It was like, let's have a room. We have to have a room for emergencies, and we'll just have it there. Sometimes what they did, they used to have the physicians on call, either from home or sometimes there in the hospital on a rotating basis. So one day you might get a dermatologist.
That's right.
It would be great if you had a skin rash. However, if you had a heart attack, dermatologist is not the best one. We had radiologists on call, and they haven't seen a patient, in live for years and years. It was not a good system. And thank goodness for that white paper. Thank goodness for a lot of the giants who called out that emergency medicine is, we need people who were dedicated to it, and that's how it happened.
Well, you mentioned feeling like you were blessed to be in this timing. I've mentioned this before when we talked about my heart attack and the fact that I'm here because of what we have here locally. We in this county have been blessed so much more than other counties in many ways because of guys like you that got into this so early on. We are advanced much further than a lot of areas are.
Especially for the rural areas.
Right.
This is a rural area, and actually there's a recent study that showed that rural areas unfortunately have a higher mortality rate than the urban areas, mainly because they are so far from some of the very advanced definitive care. Now, we do it a lot at Uniontown Hospital for a rural hospital. We do invasive care of the cardiac patient. We do lots of big-time surgery for a small hospital. But there are things that we can't do, and we have to refer some of those things out. And that's where we need paramedics again to help us, because we couldn't transfer anybody if we didn't have good paramedics, we used to have to send the nurses, deplete our emergency staff because we'd have to send the nurse with the patient. And now the paramedics are the ones that take them. We haven't sent a nurse for years and years, many years.
Yeah, people need to realize just how lucky we are here. I mean, I've been, in a lot of as a medic because of the transfers and the fact that I studied in Pittsburgh so much. I've seen trauma centers, high tech, trained centers. And Uniontown, I got to tell you, folks, when I hear people complain about it took me a little long to get in because I need a Band-Aid.
Yeah.
You don't realize the volume, first off, that our hospital does. We're usually in the either first or second most busy hospital in the state.
Sure.
In the ER. And you also don't realize just, for not being a trauma center, we're about as close as you get. I've seen some pretty amazing things done in that ER that folks don't realize. And that's, maybe we'll go to that here for a little bit before we go to the break. I want to talk a little bit about maybe some of the stories that you've seen and had in the ER. We'll do that after the break. But I want to talk a little bit just about you and your family, and you live here locally, correct? You live up on the mountain.
Yeah. I was born and raised in Uniontown. Went to St. John's grade school, St. John's high school when they had a high school. Even played a little basketball. Wasn't very good. They always said I played more football than basketball.
You were taller back then, right? You were taller back then, right?
Yeah. And then I went to, my mother was a very wise lady, and she wanted me to go to medical school. My father was a physician. Many people remember that my father was family practice for years here, and was well liked and was the typical country doctor. Who I always say was the first emergency physician, because he used to set bones in his office, put casts
he handled
on.
everything.
Yeah, right. He would do abscesses, and he would do all of the things that we do now in the emergency room. In fact, he repaired a laceration on my eye when I fell out of a truck when I was young. But anyhow, I went to Georgetown. She was very wise. She wanted me to go to Georgetown because they had a medical school. And she said, if you're in pre-med, you'll most likely get into medical school easier if you go to the same school. So I ended up living in Washington, D.C. for 8 years, which was quite an experience.
I'm sure we'll have to, that's a whole other show we can do.
Right. You could talk about that for years. And went to Georgetown pre-med and then to Georgetown Medical School. In my third year at Georgetown, actually it was the end of my second year, my mother died rather suddenly. Sudden cardiac arrest at home. My dad had an office at home. In those days, they weren't doing CPR. There was no thing like, you'd have to open up a chest to do cardiac massage in those days. And he did what most physicians did when somebody died in front of them. They tried to give them adrenaline in the heart. It was unsuccessful and she died. That made a big difference for me because I had planned before doing an internship at one of the bigger hospitals and going into one of the specialties. And instead, I was feeling very bad because my dad was all alone. So I said, I'm going to come back and do an internship at Uniontown Hospital. They had internships in those days. So I did an internship, and then 2 years I had to do, I was drafted in the service. And then after the service, I came back and worked in an emergency room in Pittsburgh Hospital, and intended to go into orthopedics. And did my first year of a residency down at WVU. At that time it was the would have been was equivalent to the second year of postgraduate work, and because of some financial difficulties, I had to leave it, and temporarily I was planning on going into the emergency room. That was in November of 1966, and I haven't left since.
I was 2, Doc. Just thought I'd throw that in there.
So, I was 2 too.
You've got to see, and we talked about this a little bit. We've gone, especially with the emergency room, from having, and I can even remember some of these days where you talk about patients coming in a paddy wagon, police cars. I can remember, there were no ambulances. We used hearses.
Yeah, that's right.
And it was nothing to have a funeral home pull up to your house.
The only one that had the
fit.
Yeah, that's right.
I can remember those days, even my volunteer days at Hopwood. And now it was a little bit before me, but seeing the pictures of the old and Uniontown, Hopwood, I think maybe South Union. There was only a few of them.
Oh yeah,
that did that back then.
That's right.
And it then progressed to, back then, I can remember when I first started, if I had a CPR card, I was God.
Yeah, right.
You were the highest trained guy in the area.
Yeah, right.
Now we have EMTs, we have paramedics, we have specially trained paramedics, we have different levels even above that in the emergency side. They then go to the hospital in an ambulance that costs hundreds of thousands of dollars now.
Yes, very expensive.
It's literally a rolling emergency room.
Yes.
And then they show up at a hospital that is now. I'm sure it's got to be amazing to you. What you started with and what you left.
Fantastic. Yeah.
The stories, like I said, have got to be immense.
Yeah.
Let's go ahead and take a quick break. Let my sponsors get in here, and we'll come back more. And I want to talk about some of the stories from in there, and maybe where you think we're going to be ending up here down the road with hospitals and emergency medicine. So, folks, this is Dave Schau, your host for Truth for America. My guest today is Dr. Corrado. Gentleman, and I'm sure has touched probably just about everybody at some point around here in some form or fashion. We'll be back in just a minute with more Dr. Corrado. Okay, I'm just checking my time here.